are, of course, many strong views on the NHI and whether it will be implemented and whether it will really lead to, as government has promised, a universal health care. Dr. Mvuyisi Mzukwa is the chair of the SA Medical Association. The SA Medical Association has, up until now, opposed the implementation of the NHI. Dr. Mzukwa, good evening to you. We have this promise from the Gauteng Premier. How do you view what's playing out here? Is this becoming political in the elections?
Good evening to you, Steve, and to your viewers, and thanks for having me in your program. Steve, you know our stance as it relates to the NHI. We support the objectives of the NHI, but we have a serious problem with the, the current form of the NHI. So we noted the address by the Gauteng Premier, Honorable Lusufi, when addressing members of the public there. But I do believe that that was really misleading the public, because all along we've been told that this bill will be implemented in phases. But on top of that, he really doesn't understand how the healthcare system works. You don't just go to hospital, whether it is a public hospital or private. There is a referral pattern in the country where you must first be seen, at a primary healthcare level, like the clinics, depending if it's an emergency, obviously, you can go to hospital. But we encourage communities, first of all, to, approach their local clinics, their local doctors, and be seen at that level. And then if there's a need to be admitted or to be referred to a specialist, then they'll be referred to a specialist. You can't tell the public that they must just simply go to hospitals come the 29th of May, because he knows very well that, it is not the truth. It doesn't work like that.
Do you believe, if the NHI bill is signed into law, from what I understand, there's going to be strong opposition to it. Are you going to be one of the parties that would go to court to stop it?
We have done all our best, Steve. If you look at the contributions that we've made in terms of trying to guide the process, from a professional association point of view, we've contributed to the green paper, the white paper, the bill itself. We've made oral presentations to Parliament. All those avenues we're using because we wanted to convince our government that we are not pleased with the current form of the NHI, and especially because our healthcare system is not ready, to accommodate the NHI. If you talk about, the infrastructure, the leadership and governance, and absence of medicines and vaccines, and all these things that we do not have at the moment, especially when it relates to leadership and governance, it's not going to be sorted out by the NHI. The finance aspect is just one part of it, but there are other issues that we need to address. So I don't think that, the leadership is telling the public what they should be expecting. I was born in the Eastern Cape, in a small town called Flagstaff, Emanguzu. That's my village. This government promised water. I am telling you, there is no water in that area, even in the surrounding areas. 30 years into governance, you can't provide simply water, and you expect that you can, just come up and implement such a complex issue like healthcare. That is why we're saying, just do what you can do. This government has been guided by the United Nations. There's a report that came out where it was assessing progress of universal healthcare coverage in the countries, and it found that they're still very far to achieve that. All they did to them was to say, focus on the primary healthcare, PHC. Focus on PHC because you can achieve 90% of what you want to achieve if you attend to PHC. And that would be assisting the country in terms of, populating those clinics and making sure that they're up to scratch in terms of providing services to our country.
Dr. Mvuyisi Mzukwa, thank you very much indeed. Chair of the SA Medical Association. More news to come on The Pulse.